When I think about the future of healthcare, I picture a world where health isn't just about the next pill or procedure. It's about addressing the root causes of illness. Housing insecurity, food scarcity, mental health crises. These health-related social needs are often the real threats to healthy living. Addressing social drivers of health is not just a crisis. This is an epidemic of inefficiency as healthcare spending continues to rise, while the health of vulnerable communities in need of social care continues to suffer. At Vertex, we're taking a transformative approach to this problem. Our social care coordination platform equips care providers with tools to assess for social risk factors before providing social resources to address them. Although there are other digital solutions in this space, this platform goes beyond by empowering healthcare providers with trauma-informed tools that are needed to promote trust in the care coordination process. This isn't just another tech solution. This is a collaborative, integrative leap forward in how we provide trauma-informed, value-based healthcare. Recent guidance from the Center for Medicare and Medicaid Services and the Joint Commission actually spotlights the necessity for addressing social drivers of health. Moreover, the advent of new medical reimbursement pathways for social care coordination underscores a pivotal shift in our healthcare paradigm. We are at the threshold of a new era where integrating social care into healthcare is not just optional, but essential. Integrating social care into healthcare also presents a significant opportunity to improve health outcomes while simultaneously reducing unnecessary healthcare expenditures. By addressing health-related social needs in high-cost settings such as emergency departments, we can not only alleviate a significant strain on our healthcare system, but also pave the way forward for more sustainable value-based care models. Now, what sets me apart from other tech entrepreneurs is the clinical experience that I have in working with this problem firsthand. I've worked with patients who have been suffering by not having the resources needed to live a healthy life. My entrepreneurial journey has been molded by these firsthand experiences and a commitment to heal not just patients, but the healthcare system itself. If you'd like to join me on this mission to redefine the future of healthcare, please reach out to me via LinkedIn or email if you're interested in being a potential advisor, investor, or partner. Thank you.
So, great job, Mo. Good to see you again.
Good to see you too.
Thanks. So you're a busy guy.
A bit, just a little bit.
How do you foresee taking this forward given all of your school responsibilities?
Yeah, absolutely. I would say the time constraints has probably been one of the most significant challenges in the past couple of years, balancing medical school and business school with the startup as well. But it has absolutely taught me how essential it is to have a good team around you. So I would say the past half year or so, that has been one of my most critical endeavors, is to build an effective team and have the right resources around me so I can rely on them as we start pilots in the fall and work towards our market strategy and launching in 2025. So that has been a critical piece as I've surrounded myself with a very effective CTO, a chief strategic officer as well that's been very effective throughout this process, and a couple of other business partners and consultants who've been very effective in this past phase.
Thank you, Maurice. Nice presentation. Go into a little more for me. What is trauma-informed tools, and then specifically, are you targeting Medicaid through the states or through the service and medical providers themselves?
Yeah, for sure. So I'll start with trauma-informed care, as this is a care modality that is not commonly known, especially in the digital health space, but kind of talks around recognizing the impacts and effects of trauma on daily living and looking at the long-lasting impacts of it. And this is a very critical modality when it comes to social care coordination, because a lot of the patients that are suffering from social needs are coming from vulnerable communities where they've experienced various levels of trauma, which significantly impacts the provider-patient relationship. So in terms of actually understanding how to address the problem of social care coordination, the importance of promoting trust and building that connection between providers and patients and really understanding what those critical needs are in that care coordination process, I think is something that's commonly overlooked and is an essential piece in terms of effectively figuring out what resources these patients really need. So there are a few different ways that our platform encourages it empowers the users of trauma-informed care through trauma screening, through trauma-informed care plans, where we can look at the aspects of a patient's trauma history that's relevant to the visit today, while also providing trauma-informed education for organizations that want to become trauma-informed on an organizational level and implement that into some of their change management strategies. In terms of your second question about kind of our target population, so this would be a Medicaid solution where we would be targeting Medicaid insurers as that particular patient population tends to suffer most significantly from these social risk factors. So that would be the target population that we would be targeting, going with a per member per month pricing model to cater towards those insurers.
Okay, thank you.
Yeah, great presentation. Thank you for that. You talked about your current target customer as Medicaid insurers. Yeah. What sort of voice of the customer have you received from your target, and what sort of feedback do they have in the structure of the platform?
Yeah, so in terms of voice of the customer, this is part of the reason why I feel like trauma-informed care is a significant differentiator of this platform, as the fractured trust in a lot of these clinical settings has been a really large impediment in terms of effective social care coordination. So that's one piece that I feel will be a really critical piece in getting this care coordination problem right. In terms of other critical users and thinking about, who are the actual users of this platform, as this is a B2B solution, and it would primarily be physicians, nurses, social workers that are initially assessing these social risk factors. There's also been critical considerations in the actual clinical workflow of how these social risk factors are generally assessed that we've also taken into account with how we've tailored some of the user interface and some of the design with the platform to make sure that we're actually being responsive to customer needs in a way that other solutions might not necessarily do.